animal rescues, cute kittens and catastrophes. Join Veterinarian Dr. Alison and her adventurous husband Graham on a heartwarming journey through a day in the life of a veterinarian volunteering in the stunning Gili Islands in Indonesia. Witness the challenges and rewards of caring for animals in this tropical paradise as we follow the vet's daily routine, from being called to life-threatening emergencies, to desexing surgeries for the TNR program to reduce cat overpopulation, and helping local pets and street cats in desperate need of veterinary care. Experience the unique bond between the vets and the island cats in this insightful and inspiring video, and catch a glimpse of real-life adventures in the Gili Islands. Welcome to the Gili Islands in Indonesia, a tiny archipelago that is only accessible by boat and where cats rule the sandy streets.
No dogs at all on this island.
Join Dr. Alison, a slightly cat-crazy veterinarian from New Zealand, and her intrepid husband Graham, where we help out at the local vet clinic, Luni Lombok.
Are you next?
An animal charity dedicated to caring for the strays and street cats. Together, making a difference for all the animals on islands where a cat ambulance looks like this, and public transport looks like this. Stay tuned to discover the joys and struggles of being a vet in such a beautiful yet remote location. Just having breakfast. This is on-call island style. I was in the middle of my breakfast.
Well, our breakfast had just arrived.
Breakfast had just arrived and we get a call from the vet saying there's an emergency. So what you do, you grab your gear, grab your breakfast and you walk as fast as you can down the island to go and find what the problem is with this cat and go and sort the poor thing out. Come along, see what we get up to.
So it needs a catheter put in or something like that? It's blocked?
Sounds like its bladder's blocked, so it can't pee, and its bladder's getting bigger and bigger like a balloon.
Ouch.
And it's life-threatening, so we're going to go and try and put a catheter in. Let's go and rescue a cat.
Just arriving at work, on style. Selamat pagi.
We arrived to hear the distressed cat's cries, but luckily with some pain relief and sedation, he was relaxed enough to pee with a little help. Relax, kitty, relax. He will be hospitalised for a few days so we can make sure he's comfortable and able to toilet by himself. So, after that busy start to the day, you may be wondering where we are. Today, we are on Gili Meno, one island away from where the Luni Lombok vet clinic is based. The cats on this island need veterinary care too. So the Luni team have packed up cages, tables, surgical supplies and medication, transporting them by boat for a week-long pop-up clinic. Thanks to Villa Pulau Sinta for offering us a space to host the cat clinic.
You're feeling better, kitty? Hmm?
There are hundreds of cats on Gili Meno, and without neutering them, they'll continue to breed, leading to an overpopulation of unwanted and neglected cats. You want to go home too? So this week is a TNR, or Trap Neuter Return Clinic, a humane way of managing a stray population. A dedicated team of cat catchers goes around the island, bringing the cats to the clinic in cages on the back of bicycles.
It's good, cheeky.
Cheeky. Each cat has an ID card with their name, where they live, and whether they are friendly, cupcakes, or a bit grumpy, chilies. After a settling in period, they are checked, weighed, 4.8? Have we got? No, we don't have all of the cat on the scales. That is cheeky.
5.2.
Yes, he's a boy. And given anaesthetic and pain relief. And then the vets swing into action, castrating the boys and spaying the girls. A notch is cut out of an ear tip as a mark to show a cat has been desexed. Every cat gets a vaccination and treatment for wounds or parasites as needed. Lunch. Nasi Goreng. Packaged up, ready to eat. After a busy morning, the team sit down for lunch from a local warung or family-owned restaurant. There's no Uber here, so it was delivered by bike. Two of these kittens look a bit sickly. They've maybe had vomiting and diarrhoea. And the worry is on the Gili Islands they see a lot of panleukopenia. It's a virus that causes vomiting and diarrhoea, makes the kittens very sick. It's highly contagious, and so if it ends up in the clinic and spreads to other unvaccinated cats, it's going to be a huge problem. The team are testing the kittens for this disease. In New Zealand, I don't see this disease. Why? Because everybody vaccinates their cats, and it just makes such a difference. So this is why in New Zealand your vet says vaccinate, because they can die, and these kittens, if they have it, they may die. The next patient comes in, a white cat called Sero, who has a terrible skin infection. Alison coaxes him out of his carrier so she can examine him. The fur on his face and paws is matted. He smells bad because of the infection.
You smell, it's bird smell.
And he cannot stop clawing at his face. He was crying for help. Alison checks his teeth, and luckily there were no mouth problems or rotten teeth. He is just a young cat, and while he seems a little dehydrated, he is in otherwise good health. The plan was to sedate him and give pain relief so we could shave the matted fur and clean away the pus and blood. Afterwards, Sero was popped into a recovery cage so we could monitor him as he woke. Sero was diagnosed with feline orofacial pain syndrome, a severely painful condition of the nerves causing cats to scratch at their faces. Sero was started on the medication for the nerve pain along with antibiotics and skin cream. He will likely need medication for the rest of his life to manage the condition. The next task was to check on all the patients that had surgery today to make sure they're comfortable and that there are no complications. We also replaced an IV line in a sickly little kitten called Moritz. As it turned out, this kitten was soon to be Sero's best friend. After that, the instruments need cleaning and sterilising, ready for the next day. 6 boys, 8 girls, 33 cats in the building, plus a few extras that came in at the last minute. As the sun goes down, we reflect on a busy but fulfilling day, helping the cats on Gili Meno. Volunteering for an animal charity is a special way that you can make a difference in the lives of both animals and people. And we have also made some lifelong friends. Remember Sero, who was clawing his face to shreds? Well, here he is the day after starting treatment.
This one can come out. You're purring. What a different cat you are.
And here he is, playing with his best friend Moritz. Sero's owner came to visit and decided it would be too hard for her to provide the ongoing care that Sero needed. So, Luni Lombok adopted him as the new clinic manager. And here's a picture of him as a kitten. How cute! And how good it feels to see Sero happy and living a good life. And if you were wondering what this animal is, make sure you subscribe so you do not miss the upcoming Gili Trawangan episode, where we help a kitten injured by a falling coconut. Thank you to the Luni Lombok Clinic for hosting us, and for the incredible work you do caring for the animals in the Gili Islands.
Take this down.
Come to visit the Luni Cat Cafe when you visit the Gili Islands and support their work. Links to their website in the description.
Thank you so much. That looks delicious.
And another big thank you to Vets Beyond Borders, who deploy volunteer vets and vet nurses to animal welfare projects, making the world a better place for pets and people. And if you liked this video, please like and subscribe. It costs you nothing, but it helps us to help the animals.